California Attorney General takes legal action against AHMC Healthcare over hospital closures and service reductions. In a bold move that underscores the state's commitment to maintaining accessible healthcare services, California Attorney General Rob Bonta has initiated legal proceedings against AHMC Healthcare. This lawsuit, filed on October 2, 2023, marks a significant development in the ongoing struggle to preserve critical medical facilities and services in the Bay Area. The action taken by the Attorney General's office highlights the complex interplay between healthcare providers, regulatory bodies, and the communities they serve. The lawsuit, allegations, and background. At the heart of this legal battle are two healthcare facilities: Seton Medical Center Coastside in Moss Beach and Seton Medical Center in Daly City. The lawsuit contends that AHMC Healthcare, an Alhambra-based health system, has violated the terms of its 2020 purchase agreement by closing one facility and reducing services at another. The closure of Seton Medical Center Coastside, a 116-bed skilled nursing facility that includes a 5-bed acute care unit and an emergency department, is a primary point of contention. According to the purchase agreement, AHMC was obligated to keep this facility operational until December 2025. However, in April 2023, the hospital was shuttered for what AHMC described as necessary structural repairs following storm damage earlier in the year. Additionally, the lawsuit alleges that AHMC failed to maintain stroke center certification at Seton Medical Center in Daly City, further breaching the terms of the acquisition agreement. This reduction in services has raised concerns about the availability of critical care in the region. Attorney General Bonta's statement in announcing the lawsuit, Attorney General Bonta emphasized the importance of the conditions set forth in the original purchase agreement. The conditions that were set forth with AHMC were specifically implemented to protect patients, ensure continued access to critical healthcare services, and safeguard the community's health and well-being, Bonta stated. He further expressed his disappointment in AHMC's apparent failure to meet these obligations, describing it as completely unacceptable. The Attorney General's office is seeking two primary outcomes through this legal action. 1. The resumption of operations at Seton Coastside. 2. The restoration of primary stroke services at Seton Medical Center. These goals reflect the state's commitment to maintaining a robust and accessible healthcare infrastructure, particularly in areas where medical facilities may be limited. AHMC's response. In response to the lawsuit, AHMC Healthcare expressed surprise at the legal action and contested several of the Attorney General's claims. The health system maintains that the closure of Seton Medical Center Coastside was necessary due to significant structural issues that rendered the facility unsafe for occupancy. In a statement, AHMC asserted, "The AG is under the false impression that Seton Coastside could open its doors once the roof replacement was completed earlier this fall. Not so. Even after the roof was replaced, the building was still unsafe for human occupancy, and there was no safe option to occupy the building when the other emergency repairs were still required." The health system further claimed that the temporary closure was mandated by regulators and had been approved by the state's health department. AHMC emphasized its intention to reopen the facility once all necessary repairs are completed, stating, "We have been diligently addressing these matters and undertaking the repairs necessary to reopen the Seton Coastside Emergency Department and SNF, and to otherwise comply with the AG's conditions." AHMC also took issue with the characterization of the repairs as merely cosmetic upgrades and deferred maintenance, calling such claims false and misleading. The health system highlighted its cooperation with the Attorney General's office during the investigation into these issues, framing its actions within the context of its 2020 acquisition of the distressed hospital, which was facing closure if AHMC had not purchased it. The broader context: healthcare access and regulatory oversight. This legal action against AHMC Healthcare is not occurring in isolation. It reflects a broader concern about the maintenance of healthcare services, particularly in areas where access may already be limited. The closure of rural and community hospitals has been a growing issue across the United States, with potential far-reaching impacts on public health and emergency medical services. The case also highlights the complex regulatory environment in which healthcare providers operate. The conditions placed on hospital acquisitions, such as those imposed on AHMC in 2020, are designed to protect community interests and ensure continuity of care. However, as this situation demonstrates, the practical implementation of these conditions can be challenging, especially when unforeseen circumstances arise. The role of natural disasters and infrastructure challenges. The damage sustained by Seton Medical Center Coastside during the 2023 storms brings attention to the vulnerability of healthcare infrastructure to natural disasters. As climate change leads to more frequent and severe weather events, hospitals and healthcare facilities may face increasing challenges in maintaining continuous operations. This case raises questions about how healthcare providers and regulators can better prepare for and respond to such events while still meeting their obligations to the communities they serve. Implications for future healthcare acquisitions. The lawsuit against AHMC could have significant implications for future hospital acquisitions and mergers. It may lead to more stringent oversight and potentially more detailed conditions being placed on such transactions. Healthcare systems considering acquisitions may need to factor in greater contingencies for unforeseen circumstances and potentially higher costs associated with maintaining and upgrading acquired facilities. The broader picture: a week of legal action in California healthcare. Interestingly, this lawsuit against AHMC Healthcare is not an isolated incident in California's recent approach to healthcare oversight. Just days earlier, on September 30th, 2023, Attorney General Bonta's office filed another lawsuit, this time against Providence St. Joseph Hospital in Eureka. That case alleged that the hospital had refused to provide an emergency abortion to a woman experiencing an obstetric emergency, in violation of multiple state laws. These back-to-back legal actions suggest a more aggressive stance by California authorities in enforcing healthcare regulations and protecting patient rights. It also highlights the diverse range of issues facing the healthcare sector, from maintaining physical infrastructure to ensuring compliance with medical ethics and state laws. Community impact and public health concerns. The closure of Seton Medical Center Coastside and the reduction of services at Seton Medical Center in Daly City have significant implications for the local communities. These facilities serve important roles in providing both routine and emergency care. The loss of the emergency department at Seton Coastside, even if temporary, could mean longer travel times for emergency services, potentially impacting patient outcomes in critical situations. Similarly, the loss of stroke center certification at Seton Medical Center in Daly City could have serious consequences for stroke patients in the area. Rapid treatment is crucial in stroke cases, and the availability of certified stroke centers can significantly improve outcomes for patients. The balancing act: safety, services, and financial viability. This case brings to light the delicate balance that healthcare providers must maintain between ensuring the safety of their facilities, providing critical services, and maintaining financial viability. AHMC's decision to close Seton Coastside for repairs, while potentially necessary from a safety standpoint, has created a gap in services that the state deems unacceptable. This situation raises questions about how healthcare systems can better prepare for and respond to infrastructure challenges while still meeting their obligations to provide continuous care. It also highlights the need for clear communication and collaboration between healthcare providers, regulatory bodies, and the communities they serve when facing such challenges. Looking forward: potential outcomes and industry impact. As this legal battle unfolds, several potential outcomes and impacts on the healthcare industry can be anticipated. 1. Increased scrutiny of hospital acquisitions. Future hospital acquisitions in California and potentially other states may face heightened scrutiny and more stringent conditions to ensure the continuity of services. 2. Enhanced emergency preparedness. Healthcare systems may need to develop more robust emergency preparedness plans that account for extended facility closures due to natural disasters or structural issues. 3. Financial implications. The costs associated with maintaining aging healthcare infrastructure and meeting regulatory requirements may increase, potentially impacting the financial strategies of healthcare systems. 4. Community engagement. there may be a greater emphasis on engaging with local communities and transparent communication about healthcare service changes and facility issues. 5. Policy discussions. This case could spark broader policy discussions about the balance between maintaining healthcare access and ensuring facility safety, potentially leading to new regulations or guidelines. Conclusion. The lawsuit filed by California Attorney General Rob Bonta against AHMC Healthcare represents a significant moment in the ongoing dialogue about healthcare access, regulatory compliance, and the responsibilities of healthcare providers to their communities. As the legal proceedings unfold, they will likely shed light on the complex challenges facing the healthcare industry, particularly in maintaining and operating facilities in the face of infrastructural and natural challenges. This case serves as a reminder of the critical importance of healthcare services to communities and the state's role in ensuring these services remain accessible. It also highlights the need for ongoing collaboration between healthcare providers, regulatory bodies, and communities to navigate the complex landscape of modern healthcare delivery. As the situation develops, it will be crucial to monitor not only the outcome of this specific case, but also its broader implications for healthcare policy, regulation, and service delivery across California and potentially beyond. The resolution of this lawsuit could set important precedents for how healthcare systems navigate the complex interplay of regulatory requirements, community needs, and operational challenges in the years to come.